This is No Operating Manual, a podcast about building healthcare companies when there's no one clear path and no operations manual. My guest today is Kobby Amoah, the CEO and co-founder of River Health. Kobby's path to healthcare didn't start in medicine. It moved through finance, international development, and entrepreneurship before landing on a clear focus: building healthcare that works for hourly workers. At River Health, he's rethinking how care, benefits, and trust come together for people the system often overlooks. Kobby, welcome to the show.
Thanks, Erin. Excited to be here.
So when people look at your background and they see finance and the international development and then healthcare, just a little bit about your experience and upbringing. First, tell me about your upbringing and what led you to River Health, and then a little bit about River Health.
Yeah, I'm more than happy to share. And my name is Kobby Amoah. I'm the co-founder and CEO of River Health. I was born and raised in Ghana, so I'm Ghanaian. I was born to a mom who works in public health, so I had that healthcare exposure at a very early age. And in the United States, when we think about healthcare, the issue really isn't how to access healthcare. It's really about how we pay for healthcare, right? Now, of course, there are access issues as well, but for most people, it boils down to how can you afford your health plan or how can you pay for quality healthcare services. So in so many ways, healthcare is actually really a finance issue. A lot of the problems in healthcare are finance related. So I think my background is, very relevant to the solution we're solving. I mean, the problem we're solving, I beg your pardon. And especially for a population that is often usually in the lower to middle income bracket, right? You want to make sure you're designing solutions that are affordable for that population.
So you're focused on hourly workers, and it's not that hourly workers navigate healthcare differently, like they're using the same healthcare, but their choices are just a little bit different. So what did you learn early on about hourly worker needs versus maybe a typical company needs? And then how did that help shape the company's direction?
Yeah, I think when you take a step back, we essentially have a dual class system in the US where if you are a salaried employee at a company that has over 50 employees, your employer is required to offer you health insurance that's affordable, right? And that's a good thing. However, these protections do not apply to hourly part-time employees, seasonal workers, 1099 contractors, temp workers, right? The employer is not required to offer them health insurance or health benefits. For employers, it's also not that they just don't want to do it. It's also super expensive for employers to offer benefits to their hourly workers. The average hourly worker makes $35,000 a year. The average cost to offer a group health plan to an individual is about $9,000 a year. So if you go to an employer who's spending $35,000 a year to hire an hourly worker and you ask them to pay $9,000 more in a 12 months period just to offer them health insurance, they're just not going to be able to do it. Right? So hourly workers have a set of limited options. One, if you're under 26 and you're in your parents' health insurance plan, and that's a good plan, you want to stay on the plan, or if you're in your spouse's plan and your spouse has a good health plan, you want to stay on that plan. Or if you qualify for Medicaid, then you want to enroll in a Medicaid plan as well. However, if you look at the majority of the hourly workforce earning on average between $35,000 to $45,000 a year, most of them make too much money to qualify for Medicaid, but not enough money to be able to afford a really good health plan on the exchanges. And that's where River Health comes in, right? And so we're trying to figure out how do we build solutions that's super affordable for that population and actually covers their everyday healthcare needs without breaking the bank.
So what does that specifically look like when you're trying to build something that's not on an exchange, but still has to follow, the Affordable Care Act, governance? So what does that really look like?
Yeah, so at River, we have two plans on the market, right? Our first plan is what we call our River Health Essentials Plan. Our second plan is the River Health Complete Plan. Now, the Essentials Plan, as the name suggests, is really designed to offer essential healthcare services to hourly workers, right? And it starts at $50 per employee per month. It is not a health insurance plan. It's essentially a subscription plan focused on primary and behavioral healthcare services. So for $50 a month, the hourly workers get an access to unlimited virtual care from a team of dedicated virtual primary care providers. They also get access to in-person primary care from a network of over 25,000 clinics. They get access to prescriptions. We have a formulary of mainly generics, about 7,000 medications that we offer to our members at no additional cost. They also get access to unlimited virtual mental health care services, in addition to lab testing and limited imaging, right? So these are about 90% of the services that hourly workers use on a day-to-day basis. What that plan doesn't cover is catastrophic care or surgical procedures or hospitalization. And that's by design. When you look at the hourly workforce, sizable portion are actually enrolled in catastrophic plans from the exchange or bronze plans, right? So if you're a 29-year-old, you probably have a bronze plan that has a $7,800 deductible. And so in the absence of a catastrophic event, so you're never going to meet your deductible. And that's where the essentials plan comes in. You usually get in the essentials plan from the employer, either at a reduced price, so maybe the employer is paying 50% of the cost, or in most cases, the employer is covering 100% of the cost. So the employee is able to get access to essential healthcare services with no out-of-pocket costs, right? So if they have an upper respiratory infection, they need access to birth control, they need these everyday healthcare services, or they need to go to urgent care, they can access these services at no out-of-pocket cost to them. And in the case of a catastrophic event, you can go dig up that catastrophic plan or that bronze plan that you have, right? So that's the first plan that we offer. Now, we recently introduced a complete plan, which is an ACA plan to also add that catastrophic layer on top of our essentials plan as well. So if you work for an employer who offers a complete plan, you essentially get the full bundle. You get catastrophic coverage, but you also get the essential services at no copay, at no deductibles. So it really depends on what the employer is looking for or what that hourly worker is looking for. We have two plans that can meet the needs.
So it seems like the cost factor is much lower than you'd expect. I guess my question is that because it's mainly telehealth and it's for really standardized, very specific things, or how have you been able to keep those costs down?
Yeah, it definitely starts with a plan design. So if you look at any traditional health plan, maybe the health plan is renting a network, for example, or they have contracts with different health systems, right? We started by focusing on your high frequency, low cost events and engineering the entire plan to be super affordable. So I'll give you an example. We're not renting a network or using a claims manager. When you sign up for River Health, we issue you a River Health branded MasterCard. And that allows you to see any of the providers that we partner with. You just show up, you swipe the card, the providers get paid on the spot, can be rest assured that you're not getting a bill in the mail. What that does is it eliminates that middleman, right? So it helps us really keep administrative costs super low. Now, of course, on the $50 plan, main reason why it's also affordable is it doesn't have that catastrophic coverage component built into it. But again, we're looking at the services that hourly workers are likely to use on a day-to-day basis, and that's the majority of the services that the Essentials plan actually covers.
Awesome. That's a really great explanation. Thank you. So you've worked, this is your first kind of healthcare experience job. You've worked inside of other organizations and as a founder. What skills and perspectives from those earlier roles have been most useful to you as you've grown River Health?
Yeah, I think, as you start to scale a healthcare company, you really have to start paying attention to the details. I think, for when you're starting a company, you're trying to put together a minimum viable product, go to market, get some feedback, iterate on the product. But as you start to get large and start to deliver healthcare services on a larger scale, you have to really pay attention to the details with compliance needs or the healthcare needs of our members as well. And so that's where background in other fields and in finance it becomes super helpful. However, if you look at our team, we have a lot of individuals on our team who just don't have traditional healthcare experience, right? And that's because we want people to bring different perspectives from different industries, right? Whether it's engineering, whether it's design, whether it's finance. That's what makes River Health unique. And so we're always asking, why does it have to be done this way? Why do we do it this way? Can we do something different? And that's where it becomes really helpful when you have individuals with different perspectives at a healthcare startup.
Yeah, it's hard sometimes when you're enmeshed in it to go, well, that's just how it's been done, right? So
Yes.
good to have that perspective. Yeah.
Yeah, you definitely hear that a lot, especially if you talk to individuals who've been in the healthcare industry for a long time. You tell that's how it's always been done. And to be fair, sometimes that is very useful, right? There's a good reason why certain things are done the way they are, and so it's important to understand why it's being done now and just make a decision. Is this going to serve you? Is this easier? I talked about our debit card system earlier on. There's a bit of a learning curve over there. The general public is used to getting an insurance card and showing up to the clinic and presenting the insurance card. And so when they have RiverHealth now and then you issue them a RiverHealth branded MasterCard, first question is, what do I do with this, right? Is this an HSA? Do I have a new account? So there's a learning curve over there. So sometimes it's a little easier to do things the way it's always done. But if you want to build something unique and also affordable, you have to find a new way to do some of these things.
Got to reinvent it.
Yeah, exactly.
So, what are you doing in your career now that you would have never imagined 5 years ago when you started River Health?
Yeah, that's a really good question. I think a lot of where I spent I spent a lot of time just trying to understand the regulatory landscape. What's happening, what's going to change. So, for example, the advanced premium tax credit went away. That has a huge impact on our business, right? So I really didn't expect to spend time paying attention to policy and healthcare bills in Congress and how that could actually impact our business. But that's also super important, right? The other thing is just I also spend a lot of time thinking about how to educate our members and educate patients on how to use the service. It's very easy for people in the healthcare industry or people who are technical to just understand some of the basics, right? Like what's a deductible, what's a copay, what's a network, right? What does it mean when we say primary care provider is not in network? And so we spend a lot of time to understand how to just explain these concepts in plain, simple language for members to be able to understand. Uh, Finally, I also just enjoy building products for members and just like watching members use the product and get some use out of it. That's also exciting. But the first two items are things that I didn't expect to be doing at this point in my career.
Yeah, I think every builder has to be looking on the horizon for what's happening in healthcare policy, especially
Yeah,
right now. Um,
right.
when you talked about building the product and watching people use the product, is that what you enjoy most about your current role? What is it? What is it about what you're doing now that you enjoy the most?
Yeah, I think that's definitely up there, right? Watching people use the product. And when we talk about building the product, we're bringing, different teams within River Health together. There's obviously the engineering team that's writing the code, designing the product and shipping the product. But there's also the plan design, right? What are the services that we want to cover? What's the experience behind actually getting your medications, right? What vendors, who do we pick or who do we partner with? For example, we recently launched with Amazon Pharmacy so that our members can get their prescriptions delivered to their doorstep. And it's very so just thinking through that process, like who's the best partner to actually deliver prescriptions to members. That experience is really rewarding for me.
Did you ever think that you would be working with Amazon Pharmacy like that? Is that just part of the thing, or has that been part of the plan all along?
Definitely not. That wasn't part of the plan, right? And I think for us, our model is pretty straightforward. We want to be able to offer healthcare services at an affordable price. So we're always trying to like optimize more services, keeping the price low, or reducing the rate of increase, the cost of the plan. And so you're always looking for partners who can do that for you, right? So if you're looking for a partner who is very good at delivering, yeah, you probably want to work with Amazon. And so it's been great.
Definitely. You've spoken in the past about trust as a core part of the healthcare experience. What does building trust look like day to day at River Health?
Yeah. So, if you think about the typical Rev Health member, let's say an hourly worker who, works at Raising Cane's or Cracker Barrel or Taco Bell, or Kohl's, they're very busy, right? They have to wake up in the morning, they have to pick a shift. Sometimes they come home late. And so when they need healthcare services, they need it now and they need their health plan to work. Expecting their medication and it doesn't arrive on time and they have to go to work. That's another day that they have to go without getting their meds. And so when we think about trust at River Health, it's really about consistency and delivering what you promised in your benefit summary, right? Internally, we also like to say, what you see is what you get. So we don't want to promise something that we can't deliver. So our formulary is public, our covered labs are public, our full benefit summary is public, right? So before you sign up for River Health, we tell you all the services that you're going to get. And when you actually need those services, we want to make sure that you can access it and you don't have to wait or, they're denied claims, something of the sort. So when members come to expect that when they need healthcare, they can actually get it from River Health consistently, that's what actually builds trust. So we're a sizable portion of our membership are actually members who joined the plan through the employer. but they've churned from the employer, but they're paying out of pocket to keep the River Health plan. So that shows that they've gotten a lot of value out of the plan and they trust River Health to deliver the services that were promised to them.
That's great to hear that there's no, lower churn, especially since they're then paying it themselves. But it's also very interesting that literally delivering on what you say you're going to deliver is delivering. It's just delivering on that experience that makes it exceptional, right? In healthcare
Yeah, yeah.
versus something that's extraordinary. You're just saying you're doing what you said you're going to be doing, and that's what's making people stick with River Health.
Yeah, definitely. Part of it is also members understanding what you're getting, right? So if you look at some of the products on the market, targeting the hourly workforce, let's say, indemnity plans, that's usually a very complex product even for people in healthcare. So if you tell the hourly worker for every hospital stay, every day you spend in the hospital, I'm going to pay $900 or $1,000. They have no sense of what that means. Right? What should the average hospital stay cost? Like it's very confusing, right? Or if you introduce a concept like co-insurance, it's okay, you have a 20% co-insurance. Okay, what does that actually mean, right? So when they actually try to use the service and they get that bill, maybe the insurance company did not misrepresent the benefit. They told you that you have a 20% co-insurance, but that hourly worker does not know that a 20% co-insurance means that they now have a $3,000. So we try to keep it as simple as possible. And if we can't cover a service within our plan without introducing deductibles and co-insurance, for example, then we're not going to cover it at all. We're just going to be upfront with the members so that they know what they're getting in their benefits and they can access it accordingly.
Got it. Yeah. I mean, 20% of what, right? Like that's
Exactly.
the question mark. You have no idea what
Yes.
that's going to cost or what's going to happen.
Exactly. Right. Right.
Yeah. I
Spot on.
think that consistency is in that experience is important.
Yeah.
So for founders interested in building healthcare solutions for, hourly earners, what lessons from your journey would you want to share early on with them?
Yeah, so the first thing is you really have to spend a lot of time understanding who you're building for. And that seems like a no-brainer, but usually builders like to build first. That's what we do. It's fun to build new products, but just spending time with the individuals who are going to use your product, understand what's important to them, right? Like and what you're actually building for. At the end of the day, if you look at a product like River Health, like we don't want you to spend too much time in the River Health app. If you spend a lot of time in the River Health app, it actually means we're not delivering the services that we promised, right? You're sick, you want to find a provider, want you to come and get the information you need, and then you're out, right? You don't have to think about us till you're sick or something of the sort, right? So fully understand who you're building for before you go out to build. That's one. Then the second thing is just don't be afraid to experiment. Healthcare is super complicated. There are a lot of regulations, but you always have to create room for experimentation because if you're spending time with your end user, they might have ideas on suggestions on what they really want, and you can step outside of your core product, run a few experiments, and if you can see some traction there, you can continue to expand on that product. And then finally, build a great team, right? Find people who are experienced in healthcare, but also people from other industries, put them together, allow them to disagree, allow them to share their opinions. And that's a great way to build a great product.
Love it. That's a great ending. Thank you so much, Kobby, for joining me and telling me a little bit about your experience and River Health. I look forward to sharing that with others.
Thank you, Erin. Thanks for having me.
Thanks for listening to No Operating Manual. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and a review, and don't forget to subscribe on YouTube. No Operating Manual is hosted and produced by Erin O'Brien of Chemistry, a healthcare marketing and communication advisory. Visit our website at choosechemistry.com.